Top 4 treatments against cellulite with proven results. Most women wonder how to get rid of cellulite. If you are one of them, this article is for you. Even though cellulite is normal, people who want a smooth body, youthful skin, and fewer irregularities struggle to eliminate it. You can find various creams, balms, and products on the market with high, and often false claims of cellulite reduction. But, in reality, these products only penetrate surface skin layers. Dealing with cellulite requires a deeper approach and various modern technologies, such as lasers and vacuums to eliminate cellulite. Before we move on to treatments that can successfully reduce or completely eliminate cellulite, let's talk more about this skin condition and discuss the origin and risk factors. What is cellulite? Cellulite is a harmless skin condition that affects both men and women. But, there is a higher percentage of a woman affected with cellulite. Skin with cellulite has lumps, dimples and resembles orange skin, which is another name for cellulite. Still, there aren't definitive scientific studies about what causes cellulite. However, some scientists believe that cellulite is a result of a reaction between the surface skin layer and fat cells. In essence, when fat cells start poking through the skin layer, you see it as cellulite. The difference between men and women is in the skin tissue structure, which may explain why women are more likely to get cellulite. Women's tissue is connected with fat cells vertically, while men have a crisscross structure. It makes it more challenging for fat cells to protrude to the surface tissue. Cellulite scale. The scale for grading cellulite was published in the Journal of the European Academy of Dermatology and Venereology in 2009. According to that scale, there are 3 grades of cellulite. Grade 1 is mild cellulite with an orange peel look. The skin has less than 4 dips in the skin. Moderate cellulite, grade 2 has up to 9 dips and looks more like cottage cheese. The third grade is severe, and the skin has more than 10 dips. It is difficult to eliminate and requires a comprehensive approach. What are risk factors associated with cellulite appearance? Other than gender, several factors may affect cellulite appearance. You all know those women who eat junk food and don't exercise and still have smooth skin and low body fat. Therefore, despite common thinking, diet and workouts aren't the only factors that affect cellulite appearance. Here are the most important factors associated with high chances for cellulite appearance. Genetics. You can't run away from your genetics. If your circulatory levels and your metabolism are slow, as a result of genetics, you are at higher risk of cellulite. Hormones. Hormones play a vital role in many processes in the body, including cellulite production. When a certain hormonal production decreases, such as estrogen in menopause, the blood flow decreases as well. Low blood flow leads to low oxygen, which affects collagen production, which further affects the condition of the skin. Lifestyle. There is still more research required for scientists to understand the connection between diet and cellulite. Even though cellulite is more likely to develop in people with a diet rich in carbohydrates, salt, and fat, people who eat healthily also have cellulite. Standing or sitting for too long is also a risk factor because it decreases healthy blood flow. Additionally, everything that limits blood flow, such as wearing tight clothes, can be considered as a risk factor. The most effective treatments against cellulite. If the appearance of cellulite on your buttocks and thighs bother you, some treatments can help you get rid of it. But, how to choose the treatment and ensure you'll get the best results? Here is a list of the best treatments to get rid of cellulite. Acoustic wave therapy. If you are looking for truly effective cellulite treatment, try acoustic wave therapy. Not only is it effective, but the results don't need a lot of time to be noticed. You can see the difference in around 12 weeks, while some other, less effective treatments need around 6 months. Acoustic wave therapy is non-invasive and has long-term results. Ultrasonic waves break the fibrous tissue and relax the septae. That way, the waves smooth the skin and improve its elasticity. The layers beyond the surface layer get stronger and thicker with increased collagen production, so the fat cells cannot protrude. Over time, the blood flow increases, which further improves the positive effect of ultrasonic waves and the overall results of the treatment. In most cases, you'll need at least 4 treatments to notice differences, and 2 treatments per year to maintain the results long term. The treatments last less than an hour. They are painless and don't require any recovery, which means you can continue with your day after the treatment. Ultrasonic waves are also used for reducing stretch marks, scars, and other conditions, such as kidney stones or Achilles tendonitis. Acoustic wave therapy doesn't have any side effects and doesn't require you to follow some strict rules during the treatments. But, if you have very sensitive skin, you might notice small bruises on the surface. Laser treatment. Cellulase is the only FDA-approved laser treatment for cellulite. It is effective, but it requires time to work. The Cellulite treatment is relatively expensive, and you can see the results with only one treatment. However, the results will gradually appear after 3 to 6 months, even 1 year, after the treatment. The results are permanent, which is why many people prefer laser treatment over some other semi-permanent cellulite reduction treatment. The laser can improve collagen products, thicken your skin, and make it look youthful and healthier. Cellulite doesn't treat cellulite appearance, it deals with the skin structural issues that caused the cellulite in the first place. The laser treatment is effective on hips, abdomen, buttocks, and thighs, all the places where you can notice cellulite. The Cellulase treatment includes oral sedation and numbing injection to ensure a painless procedure. Then, the specialist inserts cellulase laser into the skin, which then improves the skin condition from inner skin levels. Over time, lasers eliminate lumps and fat deposits, reduce the cellulite appearance and make the skin stronger and healthier. Cellulite is another effective treatment against cellulite that works from inside the skin. Similar to the previous treatment from the list, Cellulite concept is one and done, which means you only need one treatment to see the results. Cellulite is minimally invasive and causes only minimal discomfort to the patients. A suction device is used to pick the patient's tissue around cellulite dimples, and a thin needle is inserted into each dimple. Then, the certified workers will use a specialized vibrating needle to break the bands underneath the skin surface. The treatment can last from half an hour to 1 hour and a half. The duration depends on the size of the treated area and the number of dimples. Once the treatment is complete, it is normal for the tissue to feel and look sore, and the patients are asked to wear compression garments. In a week, the soreness passes, and you are left with smooth and dimple-free skin. Subcision. Subcision is a minimally invasive surgery, effective against grade 2 and grade 3 cellulite. It is completed in local anesthesia, with special needles for cutting the bands connecting the fat cells with the surface skin tissue. Subcision is sometimes done with fat transfer treatment. During the treatment, the patient's fat is extracted and used for filling small pockets in the skin. As a result, the skin is flat and smooth, tight, and fresh. Some bruising and soreness are normal after the treatment, but patients are able to continue with their day with no limits as soon as the treatment ends. The results can last up to 3 years, or in some cases, a lifetime. Which treatments aren't effective against cellulite? Body wraps and various products, masks and clays, don't do much in terms of cellulite reduction. They can make you feel better, relax and refresh, but they won't reduce the appearance of orange peel. Also, popular fat-freezing treatments and anti-cellulite garments, weight loss, and other common advice won't help you get rid of cellulite. Roller suction treatments, in theory, increase blood flow and can help eliminate cellulite. But, in reality, these treatments only have a temporary effect, and this effect depends a lot on the patient and current skin condition. Also, if not done properly, these treatments can rip the skin tissue. Final words. As you can see, cellulite can be wiped out. It requires time and money, but if the orange peel appearance on your skin affects your self-esteem, there are ways to treat it. However, the treatments against cellulite are expensive, so try to find a place with certified practitioners and doctors that perform any of the treatments described above. Those are proven to reduce and eliminate cellulite. Other treatments offer only temporary effects or require more research. Have you ever went on treatment against cellulite? Which treatment? Was it effective? Please share your experience, we're in this together.